Thank you. Thank you. Good afternoon, one and all. Today we're talking about, I'm basically an Ayurvedic physician based in Kerala. We've been dealing with a lot of COVID cases, and when the topic on therapies or dealing with immunity came up, I was really interested to talk about COVID because I don't have to stress about the importance of COVID this particular time because we know what's happening with the pandemic. So I thought we'll be talking better. It's about immunity in this particular scenario. I would suggest few treatments and few how to go about this particular condition with from our field, how much we can go ahead treating patients with COVID. So the early stages are usually manageable, but most of the time we find that critical patients are not taken over by any of the R systems, as far as I'm concerned. I mean, like as far as my knowledge is, goes. So I wanted to tell that this also can be addressed, but to an extent. So how far we can go, and how is it seen from the Ayurvedic perspective? This is what I'm going to talk about. My talk is basically about this. So, so the topic again. So next slide. So the next, the topic here is immune dysfunction, because we know that certainly there's a dysfunction about patients getting cured, and that percentage of patients which is not getting cured. The dysfunction, the difference is the dysfunction in their immune system. And obviously, there are a lot of studies on hyper-inflammatory status of that particular, the critical patients suffer from. So, and how far we can deal with Ayurveda in this particular scenario. So, can start the Nemesis or Sadhyo Vamanam. We're talking about Sadhyo Vamanam, which is giving emesis to the patient, that is clinical emesis to the patient to reduce this particular scenario. Can this be a solution in COVID-19 or SARS-CoV-2 infection? Next slide. So when we talk about this, there's a famous quote about this. It says, the pandemic has turned teacher to sternly remind us that strong health systems are vital to sustainable, stable, and secure development because conventional treatment are yet looking forward for many improvements in their system as well as from other systems as well, says President of the Public Health Foundation of India, Mr. Srinath Reddy. Next slide. So where are we now? We find that COVID-19. We started off with the spike protein S to angiotensin converting enzyme ACE2. We know that people have been talking about labs, that it originated from labs or animals, and it's zoonotic rather. So we're talking about, COVID-19 has progressed to a severe acute respiratory distress syndrome, which is a critically ill patient, severe pneumonia to, ARDS, and then we have multiple organ failure. So till that particular stretch has been seen in patients, we know that more and more people are affected with acute respiratory distress. And Delta recently has been recorded as the second most dominant after Alpha. So some countries again are looking forward for elimination versus mitigation. Elimination is very feasible for countries or states which are more isolated, like islands for that matter. And again, some other countries are looking for its mitigation though. They're planning to, probably it may the COVID-19 infection may further be like a normal cold, or it can be still more legal. This is something unguessable now. And then again, when we're talking about elimination, the news every day we're reading about the economical crisis and the social liberty that has come in because of the curfew that we have, this the infection that has spread, and how people are, their movement is limited. Everything has become problematic these days. So now, and apart from this, we know that 20 available mainstream vaccines have come out, and 289 vaccines are in the pipeline of development. So these are the current scenario about COVID-19, to just talk about to shed light on or emphasize about COVID-19. And in India, we know that particularly the first wave was handled beautifully and successfully. But the second wave actually was something which was like an eye-opener that we declared early. Actually, one of the reports says that we have declared early that we have fought against COVID-19. Second wave, daily cases, deaths, and test positivity rates have risen. Now, again, we that lot of reports on how lack of oxygen supplies, how we had to fight against this particular crisis of oxygen demand that people had against what was available. So then again, a lot of variants that come from emerged from India. We know the famous B1.617 and B1.618. Now, totally as of August 2021, like till yesterday, I think the death rates have been 1.34 in the country. The next slide, please. Now, clinical summary. In short, in nutshell, I'll not go through the details of COVID-19 because we all are updated. So just a clinical summary of it. Patients sometimes are asymptomatic, some present with mild fever, cough, headache, fatigue, etc. 20% of people who suffer from COVID require hospitalization. More than approximately 25%, it can certain reports again are presenting with higher percentage, up to 50%. So 25% ARDS pneumonia progresses to multiple organ dysfunction syndrome. And we also find that the risk factor as age, elderly people, for people with COPD, for congestive heart disease, and for diabetes mellitus, all these are coming up as risk factors. And again, reports greater than D-dimers greater than 1 mg per ml, the fatality rate is currently huge. So this is just a clinical summary for those who are just, to pick up from where we were talking about COVID-19. So the next slide, please. Now, the fight is between the virus and human. Now, immunocompetence is something, it has to be underscored because that is the one which makes a lot of difference between this fight. Which one is going to win? So people, when they have, or immunocompetent patients, COVID-19 usually loses the game. When we talk about immunocompetence, what are the points that we have to cover under this? The conserved pathogen recognition for every person, for every human, there is a conserved pathogen recognition. Now, if this is lost, the basic pathology, the basic starter is lost. Our system has forgotten to identify the virus per se. Now, it has to recognize self from non-self protein. The proteins has to be the antigen or the cells fails to identify from the self proteins and the non-self protein. This is a major important feature when when a disease, when an infection we're talking about. It has to differentiate between this. This is a memory that has been imbibed or through evolution we got it in our cells. So if this is lost, again, the patient becomes non-immunocompetent. Then we have our immunity system. You should probably by now we have talked a lot about immunity. We're talking about innate immunity, cell-mediated, or we are talking about our adaptive immunity as well. So in non-specific immunity, we have NF-kappa B, and we also have specific innate immunity. We have this is in regards to COVID-19 or virus infections. We find that specific innate immunity starts with interferons. Then we also start with a cell-mediated immunity with T cell, and humoral immunity, we know B cells and antibodies play a vital role. So this is very important. All these the factors that I've mentioned here is very important in fighting COVID-19. If there is a balance, if there is a regulation, if the production is efficient, all this can actually win over the infection very quickly. And some people probably are very, very effective in the initial stages that they probably even remain asymptomatic, fighting against the disease very easily. So this is something that I want to say before even starting about how far Ayurveda can help in the other phase of the infection. Next slide. Now, pathology of COVID-19, if you take the pathogenesis, we find that initially there are 5, when we are talking about COVID-19 infection and how the body is fighting, there are 5 methods of the body that it targets the virus. One is virus-induced cytotoxicity, direct cytotoxicity from the cells against the virus. Sometimes we find that this regulation of, if there is this cytotoxicity, if it is not enough, probably the COVID-19 infection is going to proceed. Now, sometimes the dysregulation of RA's renin-angiotensin cycle is the entire system is failing. So again, we find that this could lead to the infection proceeding to the next levels of criticality. The next one is dysregulation of immune system. Here is what our talking point is this: dysregulation of immune system as a whole. Then we also have endothelial cell injury and thrombosis leading to tissue fibrosis. So this is how they have classified 5, or either 1 or 2 or all 5 can happen together. It depends on it varies from person to person. The next slide. Now, what is this when you're talking about dysregulation of immune system or immune dysfunction? What is this? How important is this why would I talk about immune dysfunction, or why are we all talking about immune dysfunction, and how can Ayurveda assist in this particular condition? Is that the crux of my talk. Next slide. So immune dysfunction, to make it very precise, it's a long story. A lot of chemicals involved. Lot of we know that a lot of cytokines, chemokines, a lot of jargons involved. So I will not shed light into all this stuff. To make it very precise, I've put it into 4 categories. That is, our body actually is trying to fight. As any other person, as a normal person, we always, when an antigen comes inside, there are pathogen recognition receptors, which will start to fight against the particular pathogen. So when this actually has gone astray, when it has become aberrant, what happens is intense inflammation happens. That is, the inflammation proceeds to kill the pathogen, but unfortunately it fails, or it becomes inefficient, maybe due to environmental factors or due to genetic factors that the person suffers from. Whatever it is, we find that inflammation does not stop at a point where it has to stop. It disturbs even the basic bodily functions. So intense inflammation with inefficient virus clearance is the first thing that we have to understand when we're talking about this immune dysfunction in COVID, in the face of COVID-19. Now, what happens because of this overproduction of pro-inflammatory cytokines? That is, it's not inflammatory cytokines as such. That's like, it's a lot of pro-inflammatory cytokines that happens over a period of time. Now, this is something like a spillover, something that has happened. Normally we want something good to happen, but unfortunately it spills over and it affects the entire system. So this spillover is something which has to be curtailed, and it has to be taken care in the initial stages. Otherwise, it can further into alveolar capillary barrier disruption. This is in particular to lung infection. I put it as a barrier disruption in terms of lung infection, but in other systems also we find similar infiltration happening. And when that happens, there is a breach. When there is a breach, we're talking about structural integrity itself being lost. So from the cellular level, from between within a cell, while apoptosis has to happen, when we are talking about pyroptosis again, programmed cell death. The programmed cell death has to happen in a particular or in a very consequential way. But when it does not happen in the way that it is supposed to be, what happens is a breach. When there's a breach, then some structural integrity is lost, which is a winning point for the virus. Then again, our body does not stop because we are fighting against particular pathogen. So there is a storm of cytokines. We have put it as it is something like a storm because such an amount of cytokine are released from the body, damaging in terms of damaging the virus, but actually because of the inefficiency of those molecules, I should say, macromolecules or micromolecules, it does not hurt the virus replication. It does not give the intended relief, but actually disturbs our body. So this is in the small picture that I can put for immune dysfunction, what is happening within inside body. Next slide. Now, what happens during the cytokine storm? Again, furthering into our topic about cytokine storm and how we are going to deal with it with Ayurvedic medicine. Next slide. Now, when we're talking about this cytokine storm, again, faulty immune response. It is actually, it's faulty. Initial stage itself, it has become faulty. What has to be recognized, it's not recognized. What has to be beaten out or taken out is not done. And instead of that, there is hyper-intense inflammation. Whenever there is hyper-intense or when there is ashukarithom, we call it, in Ayurveda, we call it as ashukarithom, a very sudden or exaggerated response, very fast. Impaired immune response and exhaustion. We're talking about innate immunity, exaggerated. When something is exaggerated, we always talk about how it is atipravati, srotas atipravati, or how the channels, or how the endothelial system, or any other, the channel that's present inside the body, how it's exaggerated, how the molecules are exaggerated in its way. And body is fighting over and over again and gets exhausted, or we call this klama, or any kind of sada, anga sada. All this can be correlated to exhaustion. Now, foreign viral proteins are still inside the body without clearance. Increased foreign viral proteins and alveolar capillary breach. So this is what I'm talking about when we are dealing with the four problems that we had during the entire, we're talking about the cytokine storm. So the next slide. Respiratory distress syndrome. It is actually, when you're talking about respiratory distress, that is, when we talk about mild asymptomatic COVID patients, it is not very difficult to deal with them with eye system, or even without, probably some patients even without proper medications are able to cure themselves. But when you're talking about severe respiratory distress syndrome, this is actually a life-threatening lung condition that prevents enough oxygen from getting into our blood. So the patient actually suffers from this distress, and he needs immediate critical care at the hospital, or at least hospitalization becomes very mandatory for this particular patient. So what happens is sudden acute respiratory alveolar capillary membrane becomes damaged, and it becomes permeable to intravascular fluid. So there is severe dyspnea, there is hypoxemia, and diffuse pulmonary infiltrates due to direct lung injury. Acute lung injury, the term acute lung injury, ARDS, along with ARDS, is a term that is commonly used when the person actually undergoes a critical care. And from there, when there is the patient is in the ICU, approximately 30 to 60% of patients, they suffer from multiple organ distress syndrome, which is quite critical, and the morbidity or the mortality is quite high. The next slide, please. Now, the conventional treatment that is currently available for such patients is supplemental oxygen. There is no direct, there's no direct treatment. There's only supported treatment. So supplemental oxygen is given, and the patient is actually put on mechanical respirator ventilation. And the positioning strategies, we know the patient is from supine to prone position and lateral rotating position. All these are actually positioning strategies to really, we have various points to justify such positioning strategies. The patient also put into fluid therapies to manage the electrolytes and to nullify the pH differences. And we also have certain medications, a long list of medications rather, to counter all these differences in the labs, perhaps. Okay, so this is how the conventional treatment is now happening in many hospitals. So what next? What is the Ayurvedic way of, if such a patient was approached, what can be the treatment that Ayurveda can provide, and how are we going to see the cytokine storm? Because we know something's happening inside the body. There are a lot of reports on this. So how are we going to see this particular in Ayurvedic field? The next slide. Now, we're talking about Nemesis, Sadhyovamanam. Sadhyovamanam actually is an emergency treatment. If you see in Ayurveda itself, it's Sadhyovamanam. Sadhya word means immediate emesis, immediate. You start the patient with immediate clearance. So obviously, many of the panchakarma that Ayurveda advocates is time consuming. That is, the first 3 to 7 days, the patient is put on snehana, or oleation therapy. Then a few days into sudation therapy, and then actually the panchakarma starts. But when you're talking about emesis, Stata emesis or Sadhyovamana, this is very immediate. We know that the patient does not have time. So there is no time for oleation or sudation. And when patient is having dyspnea, we are supposed to do it very, very faster, quicker, with quicker results. So now, why am I suggesting Stata emesis? Why is not other panchakarma taken into account? Why actually we have to do Shodhana? Now, when talking about the cytokine storm, there is something called pyroptosis, which is common. Actually, this is a new term because we have heard about apoptosis, whereas it's cell death, and we also heard about necrotic cell death. So this is something a connection bridge between these two. Probably it's an inflammatory cell death. It's an inflammatory necrosis. So it is programmed, but more like necrotic changes. It's a programmed cell death where everything similar to apoptosis happen, but finally it becomes necrotic. So this is the term that is commonly used for COVID-19 because most of the studies reveal that this kind of inflammation happens in COVID-19 infection. So the dying cells release their cytoplasmic pro-inflammatory contents into the extracellular fluid. It has been shown that the autophagy process, that is, the macrophages are going to start with phagocytosis. So the autophagy process decreases during aging. That is probably one of the reasons that elderly are usually affected, leads to the accumulation of damaged macromolecules and organelles. So all these are inside our extracellular fluid, or even if it's inside, if lung is not the main target organ for SARS-CoV per se, probably it is our gut, which is equally similar in the ACE2 receptors are quite common there too. So that is why most of the patients also complain of vomiting and diarrhea. So this is again another thing that is seen in gut, in the system, the GI system also. So this again is I can put that also here if at all. If you're talking about lung, this is sufficient. But when talking about gut, it becomes more direct. That startup could be helpful in gut dysbiosis. So can this be considered as Amavisha? Or can Amavisha is a concept? Ama is a concept in Ayurveda where metabolic wastes are accumulated in the body, which has to be shed out, which has to be taken out immediately because it is not going to undergo digestion. You are not giving their digestives, or you're not giving them carminators because it is not going to digest inside the body. It has to come out, and so because of that importance, it is also considered to be Visha, which is word comes from the word Visha. So that's another point that I can say, although this is not particularly in relation with it. But Amavisha is something that it has to be taken out immediately by Shodhana. So this is one thing that I always, when I see patients with COVID-19, although I have not traditional or conventionally, we not have standardized our treatment yet in Ayurvedic field, we are not able to treat the respiratory distress. But can this approach be efficient? Can this suffice a patient with acute respiratory distress? Now, the next slide. Now, again, vomiting. We found that vomiting actually is actually, in fact, vomiting is poorly recorded because of, it is memory bias can happen. So vomiting is quite, because of the terms that is used, patient may complain of loss of appetite. They may feel, they don't feel like eating. They have vomiting sensory nausea is another term that has come up. So poorly recorded data has come in for vomiting, but it has, most of the recent studies are talking about vomiting in par with the symptoms of diarrhea. So similar papers have presented that vomiting may have a positive effect in controlling the cascade of inflammatory response by hyperstimulation. That is, another report says that nausea and vomiting were common in mild group. So mild, when something is common in mild group, is a vomiting itself, is a body trying to eliminate the toxins that has accumulated. Is that it's just a question. It's just like out of curiosity. Another report says that proportion of nausea in non-severe patient is 23% and was significantly higher than that in severe patient. That is, severe patients only had nausea about 8.8%, where in non-severe patient it was 23%. Is vomiting help? Does vomiting help in keeping it low? Does feeling, does throwing out, does it help really patients in throwing out this pro-inflammatory cytokines? Is one of the questions that has interestingly made me do this topic. The next slide. Now, again, when we're talking about Ayurveda, many of the patients from pneumonia, I mean, it's not serious pneumonia, but up till, when a person presented with ground glass opacities, even till that time, patients were treated, and the last phase actually was Rasayana. But when you talk about Rasayana, which has got very, very big audience throughout globally, we have big audience, big supporters of Rasayana in terms of fighting diseases, in terms of infections. So Rasayana, when you talk about Rasayana, Vyadihara Rasayana is something which is very useful in such conditions of pandemic, if I have to put it that way, because Rasayana is Vyadihara Rasayana. Whenever we are talking about Rasayana, many physicians, I found that they are talking about Rasayana after a particular time. But for Rasayana to happen, there is a prerequisite that Shodhana has to undergo, like the patient has to undergo Shodhana. So prerequisite is Shodhana. And in terms of severe respiratory distress, we don't have to wait for a 7 days Shodhana. We can immediately give Vamana and then start over with Rasayana. So this is another important indicator that helps us to say starter Nemesis could be a wonderful take-up in the initial stages of the patient to proceed with treatment, other treatments, in fact, and it can come in handy for many clinicians. The next slide. So when we're talking about starter Nemesis, we find that the terms that we have used here when you talk about the ARDS, respiratory distress. So when we're talking about respiratory distress, there are certain things that will come into our mind for a Ayurvedic physician. One is Paithika Kasa, that is cough. When you're talking about the disease related to cough, we again have Doshiga, and that Pittaja Kasa, which actually has cough, fever, and pneumonia. These actually cough and fever are with respiratory distress itself is a very important indicator of pneumonia. There in Paithika Kasa, we have a starter Nemesis as the standard of care. And in all the Shwasa Roga, when the classics are referred, starter Nemesis is given as the starter of Shwasa Roga. When we're talking about Amavishya, as I described earlier, the immediate thing that is given is starter Nemesis or Sadhyo Vamana. Sadhyo Vamana plays an important role in Pittaja Kasa, in Shwasa Roga, in Amavishya. So that is the starter or the general line of treatment for all this. So in fact, when we look into this, I think any patient that would walk into your clinic for treatment, COVID-19 treatment, if he is okay with starter Nemesis, mild starter Nemesis will do. Bring out the pro-inflammatory cytokines and then start with any kind of treatment, even if he is put into a treatment with the conventional treatment. Even for that matter, I think starter Nemesis would play an important role, because this is not just it's not a matter of vomiting, but it is medicated vomiting. So probably this needs to have a lot of a study undertaken for this particular thing. So this may actually help the patient to come out of the unwanted pro-inflammatory cytokines that has been there in the body. It can actually prevent the progression of the particular, without the viral load that we have. It can actually clear the gut dysbiosis. So all this actually can help indirectly with can be helped indirectly with starter Nemesis. This is my justification for starter Nemesis to be taken as an important starter for COVID-19. Next slide, please. So Ayurvedic treatment suggested in initial severe pneumonia, when patient comes with severe pneumonia, how are we going to give starter Nemesis? So in Pittaja Kasam, Madanaphala, Randidumatorum, and Yashti, that is Glycinosa glabra, along with Vidari Swarasa. These three are the minimal. It is very easy to recommend even as a home care for a patient, or even it can be done clinically. It is very simple, involving only 2 or 3 medicines. The patient immediately after 30 minutes or even lesser time, the patient is going to vomit it out. So once vomiting has happened, then any medicine would be helpful for the patient, because we have cleared the viral load. We probably have cleared the pro-inflammatory cytokines, or even clinically to speak, the patient becomes ready for the treatments. The patient becomes happy because something has gone out of their body. Something, whenever the patient vomits, it is very difficult for the patient, but when it gets cleared, the chest is very clear, they are ready for the treatments. So this is something which I've seen clinically also. Now, the next one is early ARDS or early respiratory distress. So there again, starter Nemesis can be given with the same thing, Randidumatorum, along with Pipali. And then again here, what happens is in early acute respiratory distress, what happens is the Acharya says that after vomiting, the patient may exhibit severe distress because here the vata actually is to be controlled. So again, there you can give a purgative, a small purgative, even you're talking about laxative here, any bulk laxatives, any osmotic laxative, whatever laxatives that is coming in handy for the clinician can be given for the patient. So starter Nemesis, initially start with starter Nemesis, and then an alumina or a laxative or a carminative would help to keep the vata down. So this is another thing for early acute respiratory distress. And the third phase is late stage acute respiratory distress. This is actually not feasible with, the starter Nemesis will not help here because we have had acute lung injury. Shadajakasam is actually acute lung injury. There the patient immediately cannot be given starter Nemesis because of the weakness that he would have in his body, notwithstanding even starter Nemesis. So here it has to be treated as Shadajakasam. I will not go into detail about Shadajakasam because it deals with other decoctions and other confectionaries. So that is another treatment protocol. So I will not be dealing with Shadajakasam. I will keep it with starter Nemesis alone. So in the early stage of, till the early stage of ARDS, I think Ayurveda can go deep and further studies can be done so that we can probably treat late stage ARDS also in future. Next slide. So the roadmap of treating immune dysfunction start with starter Nemesis to control accumulated pro-inflammatory spillover. The next one is Anulomana, Virechana to correct out the dysbiosis. And we're talking about Snigdha Ahara here, and also cold therapies. And sometimes we always find that people, when they have respiratory distress, how do you give cold foods, and how do you give Snigdha Ahara? It's supposed to be Ruksha Ahara. No, actually after starter Nemesis and after Anulomana, the patient actually can be given cold therapies and Snigdha Ahara to keep the probably to keep this hyperinflammation down. That could, it's just suggestive. I'm just suggesting it. Probably that is why Acharyas have recommended, even in spite of talking about Shwasa Akasa, he's talking about Snigdha and Hima Ahara, or keeping it cold. I'm not talking about something which is fridged, but cold here in Ayurveda means of the drugs, the foods that have cold properties in nature. Then we proceed on to Rasayana, and then for Shadajakasa, when it becomes late ARDS, Shadajakasa Chigitsa, which is like, with the Laksha, Kshirapana, etc., as the initial treatment there. And why are we talking about dealing it with the Ayurveda? Because we have seen criticality increasing with ICU patients. We have seen patients becoming critical with severe ARDS. So this actually, our treatment actually stops or prevents the occurrence of MODS or multiple organ dysfunction syndrome. The next slide. These are my references. The next slide. Thank you.